Hello, my name is Courtney Bergstrom and I'm the practice representative for the Carlson Clinic. Today I would like to talk to you about how you can stay young your first 100 years. I want to welcome you all to a class that I believe will make a huge difference in the enjoyment of your life and your family's lives. I want to talk to you about how you can stay young your first 100 years. Now, I know what some of you are thinking. You're thinking, now wait a minute, the title sounds a little catchy, but do I really need to know how to stay young for 100 years? That sounds pretty far-fetched and ambitious. Well, it's really not. You need to start thinking what it means for you and your family to live a long time. So let's look at the facts. In 1900, the average lifespan was only 49 years old. Now, there is no question that this was because many people were dying at a very young age. We didn't have the types of cures or health care that we have today, but that's our point. Everyone's chances of living a long and healthy life was much less back then. As a matter of fact, the average lifespan today is 77.6 years old and still growing. In a recent study done by some scientists at the University of Texas, they reported on the Today Show that by year 2050, there will be over 800,000 Americans living to the age of 100, and some may be living to 150. So what does this mean? This means your kids and you need to know how to stay young for the first 100 years, rather than, let's say, how they're going to spend their inheritance, right? Because you are probably going to live so long that they may be retired themselves before they even get your inheritance. So yes, this is a topic you and your family need to know about. If we're going to live for 100 years, we need this long life to be a quality life. We don't merely want to exist on this planet. We want to be able to live and work and play on this planet. We want to have a quality life. Now, a whole group of baby boomers are moving into the over the 50 phase of life. And we can see in large numbers what the effects a long life can have. Long life reveals that we will have some major areas of health concerns after 50 if we don't do something preventative before we reach these old ages. For example, we are now continually being confronted with the devastation of mental diseases like Alzheimer's. It's important to know that this disease didn't just start. We just see it a lot more now because dementia usually doesn't come on a person until they're 70 or older. Now that we realize the chances are much greater when we reach this age, we need to take some special precautions to make sure we can still use our minds when we get to this age. We also see the importance of taking care of our skin. Old age has brought about a huge growth in cosmetic surgery. More and more people are trying to correct the wrinkle problems that come with growing older. But the biggest problem we have seen with our increased lifespan is the increase in musculoskeletal problems. So in other words, your mobility function. The ability to move around like we used to. We have increased the odds of living past 80, and we have increased our life's activities, but we have not changed the way we take care of our spine. We are the first generation to witness the ramifications that long life creates. But it also reveals the areas of neglect. So let's look at the stats. The most common cause of functional disability in people over 50 years of age is spinal disorders. This is really important to know because how many of you plan on living past 50? How many of you think your family will live past 50? All of us, right? All right, so if you think about, let's look at this for an example. If your house was going to be broken into and someone was going to steal all your possessions, but I knew who it was that was planning on doing it, and I also knew the time they were going to do it, and I told you about it. Would you do something preventative to stop it, or would you just let it happen? Well, now I'm able to tell you what is going to rob you of your functional capabilities and capacities and when it is going to happen. Are you going to do something about it, or are you just going to let it happen? Well, of course not. So let's do something to prevent it, right? Just like we would prevent someone from breaking into our home if we could, but I think we all agree we should work harder to prevent our health from being stolen and our ability to function rather than our possessions from being stolen from us, right? So if we think about this, if we were to lose our mobility at age 65 and we live to 105, that is 40 years of immobility and pain. So let's take a look at some areas of health care where we've already made some adjustments and some improvements for our health. So if we look at the advancements we have in tooth decay, we used to have many more cavities, loss of teeth in the years past than we do now. We take so much better care of our teeth now with all kinds of preventative care measures, and now our teeth last longer and cause us less pain. Also, more and more people are living with less wrinkles. That's right, there has been a 465% increase in the number of people wanting to get rid of wrinkles just since 1997. Wow, that's 12 million people who had cosmetic adjustments last year just to get rid of another ramification of getting older, their wrinkles. Okay, so now I'm all for us having longer lasting teeth and less wrinkles, but I think we all can agree if you can't move, a lack of mobility will make you look a lot older than crow's feet. So the only reason we respond to our teeth and our wrinkles before our spine and joints is for the simple fact that, well, if our spine was on our face, we'd probably take better care of it, right? We don't wait until our teeth fall out to take care of them, and we must not wait until our back goes out before we take care of that either. You take preventative steps to have pearly whites, and you must take preventative steps to have good mobility, since the chances are absolutely huge that you will be living 30 to 40 years past the age of 50. However, why is this even more important than taking care of your teeth? Well, because there is no such thing as a spine transplant. You can get a new set of teeth. There are many other organs that can be replaced, but if you don't take care of your spine, there is no going back. And you can with teeth. There is no crown, there is no replacement. You just have to live with the pain. But don't forget, this isn't just limited to back pain. You also cannot get a new neck. 1 in every 3 people today suffer from neck pain past the age of 50. So let's see by raising your hands, how many of you would like to use your neck past 50 without experiencing any pain? Everyone, right? So if 1 out of 3 have bad neck pain and 85 out of 100 people have back pain, that is about as high a statistics as I would think anyone would need to hear to be convinced that we need to do something preventative about this. But just in case you need a little bit more convincing, let's take a look at what will happen if we don't do anything preventative about this. So what will happen if we just let nature take its course? All right, let's take a look at this mobility scale here. The numbers on the bottom, those represent your age. The numbers on the side of the scale represent the percentage of the maximum mobility you have. So in other words, if we take a look at this graph where you can see the blue line, so you can see that you reached about 100% of your mobility, your maximum mobility around the age of 23. So now if you continue to look at this blue line, you can see that it starts to drop. Again, if we just let nature take its course. You can see here that we lose about 50% of our mobility at about 50 years old. So I know most of you that are around the age of 50 will testify that having about 50% of that mobility that we had when we were 23 is probably a little conservative, right? So now if we continue to look at this blue line, you can see how it continues to drop like a rock, right? By the time we're 60 years old, we only have about 25% of that mobility that we had when we were 23. So now the big question to this revealing graph is, can the scale be changed? Do we have to just accept this the way it is, or can we alter these results? Well, the good news is, with a little preventative care, we can make a big improvement to that line on that scale. So again, if we look at the graph, the red line represents the blue line on the previous scale. So again, that is just what happens if we just let nature take its course. However, if we look at this green line right here, we can see how we can actually change our mobility with some preventative care. On the green line, you can see how your mobility can actually be held at about 75% through the age of 80. All right, now that is what we want, and that's what we need, right? This is what we want for your family as well. If we are going to be here, we might as well be able to move and function. So why not take the necessary steps to make this happen? All right, well, one answer you may be thinking is, okay, well, this is the perfect thing to do if you're young, but what about those who have already experienced pain? What if you're already past 50? Is it too late to start? Absolutely not. In fact, I want to congratulate you today on getting here now. It's never too late to do the right thing. We want to get you on track for a great life ahead, but here's how we can do it. All right, so the first thing you need to do is follow through with the entire recommendation of care that you were given. The reason I mentioned following through is because you have already lived such a long time with the mentality that you only take care of your spine when you're in pain. This means that it's going to be easy for you to think that after you're out of pain, that you no longer need treatments. So listen, if you drop out after pain relief, you're never going to change the results of that scale that we just looked at. And remember, pain is always the last to show and the first to go. The only way we can change this scale is to follow through with all 3 phases of your recommended care. So let's take a look at what those 3 phases are. Phase 1. In the first phase, we have the pain relief stage. This may be a reminder for some of you, but let's review to make sure we all understand the cause of your pain and other health-related problems. So you have what is called subluxations, which is this picture down here on the bottom left. Subluxations is the misalignment of the vertebrae that is causing nerve interference. It is literally pinching the nerve, which this can impact many areas and organs of the body, causing a lot of disease in ways that you may never relate to an actual back problem. So picture it like this. If you were to hook up a garden hose and turn it on, the water would work perfectly fine, right? Unless there's a kink or a twist in the hose. If the hose has gotten twisted or kinked, it stops the flow of water going through the hose, right? So we might call this a subluxation of the hose. So in other words, the misalignment of your spine is causing nerve interference or is stopping the flow of messages from the nerves to other organs or body parts, causing a lot of pain and a lot of physical ailments due to this nerve interference. All right, so when the nerve interference is then removed, the nerve flow is then restored, and so is your health. However, how do we remove this nerve interference? The solution? We remove it through a series of adjustments. The adjustments gradually move your spine back into alignment and away from the nerves, allowing the body to begin to heal itself. So at this point, a lot of people say, great, I get a series of adjustments that removes the interference, getting rid of the pain and the problem. So why can't I just stop after the pain is gone? Well, again, it's important to emphasize this is only your first phase of your care. And again, this never alone will never solve your problem or change that mobility scale that we talked about. We must proceed to phase 2, which is stabilization care. So the reason why you must not stop after you are out of pain, your spine has actually been misaligned for so long, and your body has now accepted this misalignment as actually being correct, right? So your body actually thinks this is the way it's supposed to be because it's been that way for so long. So now the body, the muscles, and the spine all must be retrained. The spine must remain in a proper position for a long enough time for the body to accept this proper position as being the norm. This is called stabilization, and this stage does take some time. Unless the spine and joints are retrained with adjustments and kept in proper position for a long enough time, your body will begin to naturally pull your spine right back out into the misaligned condition it was prior to you coming to us. So, a lot of people ask, well, why does this take time and work? Well, for an example, can you go to the gym once and instantly get in shape? Can you lift weights one time and instantly enjoy bigger muscles? We all wish we could go to the gym one time and come out looking like Mr. or Mrs. Olympia, but we all know that can't be done. It does take time and it takes work. To get your musculoskeletal system stabilized is going to take some time and a number of treatments, and you will need to do them all. So another example is the orthodontist. Did the orthodontist straighten your teeth on the first visit? Of course not. Once again, this took time and work. And even after your teeth were straight, when you had your braces on, you wore your braces for even longer. And then after that, you wore a retainer for even longer. In the same way, I have given you a recommendation of care that will not only get you out of pain, but you must follow so that way we can get you in a stabilized condition, meaning your body has begun to accept and accept this healthy, proper alignment as being normal for your body. So, once we have reached the stabilized condition and we are done with that stage, we will dismiss you from active care, which is phases 1 and 2. We then move you into this third phase of recovery, which we call the maintenance or preventative stage of your care. I get the most excited about this stage because this is where we enable you to change that mobility scale and make a huge difference in the quality of your life. It isn't enough for us to just want you to get out of pain. We want to be able to move you to an opportunity where you can actually enjoy life again. This is what you want, isn't it? The good news is, with this stage, this will not require a lot of time or money. It will be simple and affordable, but at the same time, the dividends you are paid in health and life make it well worth all the effort you've put in so far. Preventative care is essential towards changing that mobility scale for your lifetime. So as I'm talking, I can hear some thoughts running through your mind. A lot of people say, okay, I knew it. I've heard it before. The chiropractor makes you come back for the rest of your life. Well, you're right. We do. But before you make any judgments, let me ask you a question. What doctor have you seen or ever been to that has said, don't come back again? Did you ever go to the dentist and the dentist said, don't come back until your teeth fall out? He wouldn't say that because that would be malpractice, right? They push you to do the right thing, which is preventative care, which is good. It's what you want. It's good for you. Do you remember when you first got your eyes checked? It was probably around, the 3rd grade. And they told you, great news, your eyes are fine. So as far as we're concerned, you don't need to bother coming back and taking care of your eyes again. Well, unless you lose your eyesight altogether, which in that case, all right, maybe you should come back. So I think it's time for all of us to be honest. There isn't any doctor who has or should recommend that you ignore your health until there is an actual existing problem. No doctor could recommend that you never come back, and we certainly can't either, right? Because it wouldn't be what you need to enjoy life. However, be assured we don't want you to come in more times than you need to. Our adjustment rooms are already full as it is. The purpose of our recommendations of care is to change that mobility scale that we looked at for your life. We can't remove your wrinkles and we can't make your teeth stay white, but we can enable you to move, work, and play, and of course, stay young for your first 100 years. So I know I sound rather passionate about this subject, and I get really anxious about everyone experiencing the benefits of chiropractic care, but let me just give you a short reason why I personally feel so passionate about this. Growing up, I was a dancer and a gymnast. That can put a large toll on your muscles and your body and your spine. And as you get older, if you're not, being more physically active and working out a lot, you notice that your muscles start weakening and you start experiencing a lot more pain than you experienced in years past. Also, I have a little bit of a GI issue, a stomach issue. So when I eat food, sometimes it just doesn't sit well with me. So I started seeing a chiropractor when I was about 12 years old. I had a great experience with it. I felt better. I wasn't using ice packs or ibuprofen as often, but I took 2 years off just to see how it was working. My stomach issues came back. My pain came back. And I was struggling. I was having a hard time sleeping. So I decided, maybe chiropractic care actually was working for me. So I gave it a try again. I went back, and within the first couple weeks, didn't even take months or years, within the first couple weeks, I already was sleeping better. I was having less pain. I wasn't taking ibuprofen every day or depending on ice packs to sleep. And on top of it, I could eat food again. I could eat food that I would even look at before and I would have a stomach ache. And now I'm able to enjoy not only life, but enjoy food. And I think food's a huge part of life, right? All right, so now you should be thinking, all right, okay, I do care. I do care about my health, and I care about the future health of my friends and my family. I have family and friends that may have never even really known or heard of the information that we have been talking about today. So what about their health? What about their mobility scale? Is there anything I can do about that? Well, the answer is absolutely yes. So it's important to know that it's never too soon to start either. So in fact, even a newborn child has already experienced great trauma to the spine during childbirth, and they as well should be examined right away. So if you think about the tremendous pressure that is put on their neck and spine during childbirth, I think it's easy for you to see that we actually start our lives with untreated problems. So obviously, your friends, your family, and everyone else you know need to come in, be evaluated for a simple and easy, healthy plan towards preventing a life of immobility. The good news is, with a little preventative care, we can eliminate much of their pain management in later years. So, I know this will be one of the best investments you can make in their retirement years. They must be able to move. So to illustrate how sincere we are about preventative care, I've asked my assistant, Erin. She's right in the back at our receptionist desk. She has our appointment book and our schedule all set out with her right now for available times for your friends and for your family. As I said, I want to put their health and future ahead of everything else. So to show you again how sincere we are about this, we are offering a great deal for first day services for your friends and family. We will allow you to bring in your family, your friends, for all their first day services, which includes an exam, x-rays if they need them, consultation, and to meet with our doctors one-on-one and go over the preventative care and plan personalized just for them for a cost of only $20. And this $20 is then donated to the charity of our quarter, which right now we're doing the YMCA. The YMCA is doing a huge fundraiser all year long to help students be able to learn how to swim, not drown, because we have a lot of people in this area who are uneducated or experienced in swimming. On top of that, they're doing a full open door policy for K through 12 for students who are struggling with reading, math, English. This $20 is donated to them so we can help out students in our area. So if you go ahead and schedule them tonight, this allows them to get started with preventative care and see for themselves how much it can mean to their health without it being a cost issue. So, to take advantage of this opportunity, you have to schedule with Erin right now. And since I know you probably don't know their schedule, I will tell you that if this time becomes impossible for them to make, all they have to do is call and reschedule, because their name will already be on the books and it won't require any explanation or arrangement other than a new time. So let's get your friends and family signed up for a better future ahead, for better mobility, a life without pain. So just get them on the books. They can bring in their $20 donation at the time of their services. So thank you very much for listening, and have a great day and enjoy living 100 years.